Hi guys, I'm Dr. Tara Tobias. I want to welcome you all back to my channel. I am super excited to bring you this third video in a series that we are doing on spasticity. If you don't know what spasticity is, or you're wondering whether or not this is something that you might be dealing with, definitely go back to the first two videos. I'll put links for those right here, as well as in the description box below. But really, anyone who has had any type of damage to their brain or their spinal cord can develop what we've been talking about, which is this movement disorder called spasticity. And what I've been going over so far in the series are conservative treatment strategies. So things that don't involve any medicine or any type of surgery. And hopefully in the last video, I connected a few of the dots between what spasticity is, why it's happening inside your body, and some things to be mindful of when you're going about your day to prevent the spasticity from getting worse. I talked about some common mistakes that I see people make as far as moving around. And then in today's video, I'm gonna go over positioning. So what is the optimal way to position your body to prevent the shortening of the soft tissues, which makes the spasticity worse over time, as well as at the very end, I'm going to demonstrate some stretches. So as I have mentioned several times in the last two videos, one of the things that makes spasticity worse over time is that the muscles shorten. So one way that this happens is the way that patients position themselves after the stroke. When the arm hasn't really regained any movement yet, most people have a tendency to keep the arm in a position where the elbow is flexed and internally rotated. And oftentimes it's almost kind of like a protective reaction. They keep that arm really close to their side. And that is a really bad position because those are the muscles that I oftentimes see have the most spasticity by the time someone gets to the outpatient setting. So whether or not I've always viewed this as that these are the most common muscles that develop spasticity after a stroke. But in more recent years, I've almost changed that a little bit to the idea or the thought that those muscles became the most spastic because they shortened the most because of the positioning of the arm. So in addition to someone just naturally holding their arm in like that, there is this very common practice in the early stages in the hospital setting and in the early stages in rehab where patients are encouraged to put a sling on the arm to prevent a subluxation, which is another problem when the muscle is weak. The muscles around the shoulder get weak, and I've talked about this in other videos, but the arm bone can actually drop out of the socket a little bit. Now, there is a point to those slings. They are meant to protect the shoulder. If you damage the shoulder or you damage any of the structures around the shoulder, it is going to be very hard to regain and redevelop the strength in those muscles down the road. However, you are almost 100% guaranteed to develop worst case scenario is severe spasticity. Best case scenario, which isn't even good, is that the arm just gets tight and gets stuck like this, and then you will lose the ability to reach overhead. I understand the point of the slings, but I hate them. I think they are the worst thing that you can do after a stroke. However, if you don't use a sling, you have to be super duper careful to protect that shoulder. It's possible, but everyone that's caring for you needs to understand the risks involved with subluxing that shoulder. And you as well need to be hyper focused on knowing where that arm is at all times. And if you can do that, there are other ways to position the arm to prevent that subluxation from getting worse or to prevent any further instability without using a sling. One is when you're in your wheelchair, they have these things called arm troughs. An arm trough stays on a wheelchair, and what I like about them is just the positioning of the arm. It positions the arm straight out which prevents the arm from coming in and internally rotating and developing tightness in those internal rotators. The downside of them is that it's really hard to involve that arm in functional movement when it's in that arm trough. So there's gonna be pros and cons, but if you could use an arm trough versus an arm sling, I would say I would go with an arm trough. And again, I will put a link in the description below of one of the arm troughs that I really like. The other thing that you can do is invest in a really cheap bedside table on wheels and just always have someone, anytime you're sitting in your wheelchair, just have a table in front of you so you can have both of your arms supported on a table. That too is a better way to position the arm in a way that's not going to develop tightness and you won't develop more disuse. Because that's the other thing I forgot to mention. When that arm is just in that sling, your brain is just going to have more of a tendency to just neglect that arm. So bedside table or an arm trough are both excellent ways to prevent shoulder injury without developing any excessive tightness in the muscles that internally rotate the arm. Now, if your arm is really, really weak and very, very limp, there is a risk that just the weight of the arm can turn into a subluxation. So the sling would become beneficial for transfers and possibly walking just for safety. But as soon as you sit in a chair, my ideal would be that you have your arms up on a table or you have it in an arm trough. Now let's talk about the leg. Very common for the muscles that rotate that leg out to the side to develop some tightness. And again, whether the tightness creates the spasticity or spasticity causes those muscles to shorten, whatever the case may be, the muscles that rotate the hip out usually become shortened and become very tight. The ideal situation is that when you are in bed, you have some kind of a wedge on that side of the leg to prevent it from flopping out and to actually help rotate it in. And when you're sitting in your chair, there's two things I like. I've shown this in other videos, but just cross your uninvolved leg over your involved leg, and that'll help to keep it rotated in. Or you can use one of the blue straps that I've mentioned in several videos, and I will put a link for that in the description below. So those are my tips for positioning to prevent spasticity from getting worse over time. As I mentioned in the last video, I was going to show you some of my favorite stretches to help stretch or lengthen the muscles that might be shortening due to the spasticity or again due to the positioning. And so the key areas that I like to focus on initially when someone comes to me are the muscles, stretching the muscles that pull the arm in or adduct the arm. So that means I work on abduction. That's one stretch that I think is extremely important. Another group of muscles that usually becomes very spastic or very tight are the muscles that extend the arm and rotate it in. So the biggest culprits are the latissimus dorsi and the teres minor and the serratus, and all of those also contribute to that arm getting stuck to the side. So the key stretches I like for this one are shoulder retraction. So scapular retraction and getting the arm extended will stretch the lat and the teres minor. Very, very, very important. And then the pecs, the muscles that bring the arm forward and also internally rotate it. So you can see there's a lot of muscles that internally rotate the shoulder, and pretty much all of those become tight and develop some spasticity after a stroke if you are going to develop spasticity. So external rotation is extremely, extremely important. Doing that in different positions to stretch the different muscles is hugely important. Now, when it comes to the elbow, obviously, if you have spasticity, you already know this is true, but the muscles that flex the elbow or bend the arm or bring the hand up towards your face or your shoulder, those become very tight and develop some spasticity. So extending the elbow, stretching the elbow into extension, and also extending it back. So some of the muscles that bend the elbow. They also cross the shoulder joint, so you also want to make sure you incorporate some kind of a stretch where you're not only extending the elbow, but you're actually extending it behind you. So a lot of people know this stretch and they have it out in front, but it's also important to extend that arm out behind you. Some of these you won't be able to do on your own. I will show you a couple of examples of how to do these if you have someone to help you. And then, of course, wrist extension. And then when we get down to the wrist and the hand, you want to stretch the muscles that flex the wrist, because those oftentimes develop some spasticity. So you want to stretch the wrist into extension. Big culprit that a lot of people forget are the muscles that adduct the thumb. So the muscles that bring that thumb in, very tight, very spastic. So stretching that thumb towards abduction. And in almost every video I have where I'm showing how to open the hand after a stroke or how to stretch the arm after a stroke, you will see that I incorporate some kind of a stretch where I'm bringing the thumb out to the side, and then the wrists, the fingers into extension and supination. So all of those, very important. I know that seems like a lot, but you need to do it. If you don't want your spasticity to get worse, this is the number one thing that you need to do. And then when it comes to the leg, I've gone over this extensively in this video right here. I'll put a link for that, and then I'll also put a link for that in the description below. Anything where I talk about the leg flopping out to the side, I usually show some stretches that are perfect to prevent some of the muscles from shortening after a stroke and possibly developing that spasticity. So check those videos out. And that is it. I promise you I am going to get to the non-conservative treatment interventions for spasticity, but I thought this was really important, and I do not know why I thought I could get this all into one video. So I will get there. But I hope all of this made sense. If you guys liked this video, go ahead and give it a thumbs up. If you have any questions, leave those in the comments below. If anything didn't make sense, leave that in the comments below. I'm a work in progress and I'm still learning, and I listen to every single one of your comments and try and adjust my style or my delivery based on what I'm hearing from all of you. If you haven't yet subscribed to my channel, go ahead and hit that subscribe button, turn on that notification bell so that you will be the first to know when I upload new videos. I am so grateful for each and every one of you. This channel is growing and exceeding my expectations, and that is definitely thanks to all of you who are sharing these videos on other social media platforms. So I thank you, thank you, thank you. If you haven't signed up for my newsletter, there's a link for that in the description below. As we head into the holidays, I know it can be a stressful time for many of you, so definitely sign up for my newsletter. I try and send out things to keep you motivated and keep you on track with your home exercises and help you to overcome some of the mental roadblocks that can occur. So definitely sign up for that. And that is it. So I appreciate you all. Have a wonderful day, and I look forward to seeing you all.